Hello, I'm Binbin. Today I will present the technology evaluation of eye transplant with my group member Wofeng. Organ and tissue donations can save and significantly improve the lives of many people who are sick or dying. For many people with a serious or critical illness related to organ failure, organ transplantation is the only hope for a healthy life. In recent years, organ donation became an important issue in many countries. As we can see from the picture, there is a research in 2011 shows that the organ donation rates per million in some countries. Organs that can be transplanted include the heart, lungs, liver, and kidneys. Tissue also can be transplanted. Therefore, a single donor can save up to 8 lives through organ donation and save or heal more than 100 lives through tissue donation. But the fact is, this is far enough. A research shows that just in US, there are about 10 people die every day while waiting for their transplant. At any one time, there are almost 1,700 Australians waiting for a transplant on the official waiting list. Many people die each year waiting for the gift of a transplant. Some patients spend weeks or months in hospital, while others make several trips to hospital every week for dialysis or other treatment. So, organ donation is a very important issue in health field. Now, I will introduce organ donation process briefly. Every organ donation is different. Once a family has given its consent, they will be asked to complete the necessary paperwork to confirm the donation. The process of transplant between a donor and a patient, there are many paperwork should be done. In the past, we need use paper to record all information of organ donation process, which may include donor information, organ information, or patient's information. iTransplant, which is used over 50 donor agencies worldwide, it was chosen for the new electronic donor record in October 2012 and has since been customized and configured to suit the Australia setting. It replaced in a consistent format the 28 pages paper form called the confidential donor referral form and includes all of the necessary donor referral data, medical, social history, and family consent information required. The eye transplant system itself consists of separate modules for organ, eye, and tissue donation, which can all be linked. The Donate Life EDR is using the organ donation module at the moment with an option to end the other modules in due course. The EDR is supported 24 hours a day, 7 days a week nationally by system administrator within each jurisdiction with further support from the Australia's Organ and Tissue Authority, which is OTA. The OTA says that since go live, there have only 2 hours to have help desk queries directed to it. To do this research, we use a scholar and industry information source. As we can see from the picture, the 3 on the top are scholar resource, and the 3 at the bottom are industry resource. And we use this keyword to do the research of our project, as may focus on the eye transplant and health and organ donations. In eye transplant systems, there should be following features. The first one will be call center and donor referral and suitabilities. The second one will be organ placement. And the third one will be tissue and eye banking. And next one is the research and analytics and reporting. And that next one is online donor registry. And the last one is customer solutions. The first one I will talk about is the call center or donor referral and suitabilities. Initiating the donor transplant process through the accurate and efficient identification, referral, and screening of potential donor is at the core of any successful organ, tissue, or eye donation recovery program. It like find a exactly piece of puzzle. iTransplant enables call center and donor screening organizations to seamlessly and expeditiously enter, track, and communicate important incoming donor referral information from an unlimited number of sources and conduct all of the activities necessary for the successful commencement of the donor process. With iTransplant, organ procurement organization can enter, manage, track, and communicate comprehensive donor and organ information in a single, fully integrated system. In iTransplant, tissue and eye banking can capture, track, manage, and communicate key donor and tissue and eye information in a single and fully integrated system. Easy to use imaging and attachment uploading capabilities are integrated with iTransplant, and comprehensive contact management and administration, traction, and security module are included. An additional supporting module of donor family aftercare, hospital development, and staff scheduling and tracking are also available.
Hi, I'm Wofeng Gao. I'm going to introduce some other features of iTransplant and make evaluation of it with triangle model. iTransplant was designed, created, and maintained into a research, analytics, and reporting system. Whether for individual organizations, healthcare networks, and industry organizations, this system helped to create real-time transparency and communications that help with compliance obligations, as well as identifying trends and positive results, as well as opportunities for improvement. It can process and show the data by different approaches, such as charts, graphs, or figures. These are some interface screenshots of iTransplant. iTransplant provides secure, web-based online donor registers to allow members of the public to register for an organ, tissue, and eye donation. As authorized by applicable law, these registers can be designed around a geographic or legal destination, state or nation government, by category or by other designation. Provide as turnkey system or available for customization on an as-need basis. iTransplant online donor registries helps to deliver the public message of donation while allowing for highly cost-effective information management and analysis. Many countries, including Australia, use iTransplant as their official electronic donor record system, since the high performance of it. Significantly, this EDR data are securely stored in cloud server. As a full-service software firm, Transplant Connect is able to consult with organizations to identify operational workflow, quality management, information management, communication and reporting needs, and to design, develop, deploy, and provide ongoing operation and support for iTransplant system of varying nature, scope, and size. iTransplant system is widely used in all kinds of health organizations since it can be customized into different types of systems to satisfy the custom requirements. Now I am going to evaluate of iTransplant with triangle model. The triangle model specifies the predictor variables that should be captured in order to display quality or safety outcomes of health IT, but it doesn't specify how those variables should be measured. These are four relevant elements in this structure: technology, organizations, providers, and patients. The first element I want to talk about is the technology. In terms of technology, iTransplant provides visualized user interface and clinical decision support, which based on the electronic donor record integration and analytics. It also offers safety data storage in cloud server to ensure personal privacy. The workflow is designed so clear so that it is convenient for using and training. Organizational mission, resources, and policies affect quality outcomes directly and also influence how well a technology is used to pursue these outcomes. Australia's Organ and Tissue Authority, the OTA, is one of the organizations which can oversee the Donate Life network of organ and tissue donation agencies and staffs in 72 hospitals around the country. iTransplant is following the law and security privacy in their services. Other organizations such as FDA, hospitals, and Transplant Connect, the developer, influence the technology implementation as well. iTransplant system make a great progress in organ donation. It replaced paperwork with electronic donor record, which improve the effectiveness of transplant. With iTransplant, doctors make decisions more accurate and precise by monitoring the donor information online. The patients can gain more benefits from iTransplant since the system deploys limited resources reasonably. For those patients in emerging conditions, there are some probabilities to get suitable organs or tissues timely since the real-time feature of iTransplant.
In the conclusion, iTransplant is a really new system and it just goes live in Australia recent years. But it is an important and useful system to improve transplant process and service. Transplant Connect will continue to be involved in further developing the product with updates to the EDR expected up to 4 times a year to ensure it keeps pace with the requirements of the donation and transplantation sectors. In the future, iTransplant systems can be promoted and accepted globally despite the challenges. The transplant activities can happen across the countries, not just the local. This will be save more lives and heal more people effectively and timely. And this is our reference, which includes the picture reference and the word reference. And thank you.